Welcome, everybody. I'm glad you could join us today. My name is Linda Lenzke. My preferred pronouns are she, her, and hers. I'm the LGBTQ advocate here at OutReach, and I am very grateful to have our guests today, which I'll be introducing very briefly, but I'm going to have them give themselves a more robust introduction to give it justice. OutReach LGBT Community Center is sponsoring this Protecting Our Health panel, which is part of the Road Forward initiative. We have with us today Dr. Kathy Oriel of Out Health and two of the patient panelists who are joining us today, who will be talking a little bit more about their lived experience. A little bit about the Road Forward. It's an outreach initiative, and it was launched last year during the pandemic, and was made possible by grants from the New Harvest Foundation, All of Us Research Program, the MGE Foundation, and Dane County of Wisconsin. It was a series of virtual education and skill development workshops targeted to support our underserved and marginalized LGBTQ+ community, which included the homeless, the transgender and gender nonconforming, LGBTQ+ seniors, communities of color, BIPOC, and individuals struggling with behavioral health, substance use, and alcohol. Today's panel is the third program in the series. Previous programs included Restoring Our Lives and Recovering Our Mental Health. Links to the recorded webinars can be found on the Road Forward website. A link to the website will be in the resource slide at the end of the presentation. Now, let me briefly introduce Dr. Kathy Oriel of Out Health, who is sitting at the other end of the table, and who will also give a more complete introduction of herself and Out Health services. And I'm going to read this portion, and this was submitted to me when Kathy, Dr. Oriel, began working with us, collaborating on the Road Forward initiative. So these are her words, and I figured it would be the best way to introduce her. Dr. Kathy Oriel is a family physician and addiction medicine physician. She has cared for and advocated for LGBTQ+ people throughout her 20-year medical career. Most recently, she founded a nonprofit in Madison, Out Health Incorporated. Out Health works to eliminate health disparities for LGBTQ people through education, advocacy, and competent, compassionate care in a small private setting. Dr. Oriel presents locally and nationally regarding LGBTQ+ health and is a past board member and president of the Gay Lesbian Medical Association. Dr. Oriel serves as an expert witness in legal cases involving care for transgender people. Now, Dr. Oriel, I'm going to let you introduce yourself, and then have the panelists introduce themselves.
That introduction sounded a bit grandiose, but mostly I just try to take care of humans. And also, to be really clear, I didn't technically, I'm listed as the founder, but it's the community that voted with their feet and volunteered time and energy and funds. That's the reason Out Health exists, not me.
I'd just like to add, though, that if you interviewed members of our LGBTQ+ community or people who are recovering from substance use, alcohol, and behaviors that no longer serve them, they would say more in praise of Out Health, all the staff, and Dr. Oriel's efforts. So I just personally want to say that Dr. Oriel is being very humble because this community is very grateful for the work that she does with all of us. And one of the things that impressed me when Dr. Oriel...
No, call me Kathy.
Oh. All right. When Kathy and I started communicating about this project months ago, last year, she shared with me that one of her missions and the Out Health's missions was whole person health. And that really resonated with me, because that's not typical of the healthcare system when you're dealing with large healthcare providers. It's like you're going from a menu, and today I'm going to get this on the menu, and tomorrow I'm going to get this on the menu, but I'm going to be having a different restaurant for that meal, and what I know about Out Health, and I'm not a patient client, but I have the privilege of being with a couple of them here today, is that people talk about it in that it is addressing some of the lack of services to our marginalized LGBTQ plus community, and that it is whole person health. It's not like you're going to see Dr. Oriel just for one thing. You're going for that ability to get the care that you need, the compassionate care that she talks about. So I've said enough right now. I'd like to turn it over to our panelists and have each of you introduce yourself.
Oh, you.
All right.
Going down the line.
Okay. All right. Doing a little circle. My name is Ryan Riley, and my preferred pronouns are he, him, and his. I've actually known Dr. Oriel for much longer than Out Health has existed, but was very thrilled when Out Health finally opened up and I was able to take part in getting services there. So I'm not very exciting. I don't have a bio to share. So I'll just leave it at that for now.
There you go.
Yeah, I might be asking some follow-up
That's
questions.
totally fair.
Hi, I'm Madison. B. I go by B, my middle name. I'm assistant case manager, victim advocate for Project Respect. I've been knowing Dr. Kathy Oriel, been a patient of hers for about 18 years. And right, she underrates herself when she gave her speech. I think she's phenomenal. I mean, she's put me on the road to so much since we've met, and my life has truly changed with her part of my life. I'm just glad to be here today, and I'll share more, answer any questions. It's free to go ahead to you now.
Just so that our audience is aware, originally I was going to function more as the moderator, and Dr. Oriel, aka Kathy, was going to kind of lead the discussion, but there's some health issues with her voice today. So I'm going to be trying to fill in for the doctor to the best of my ability. But I'm going to invite Kathy to join in whenever she can. As you can see, this is a casual group because, we're queer, we're here, and we're a little out of control sometimes, but that's okay. Yeah. So one of the first questions that I want to ask Dr. Oriel, but I also want to invite both of you to respond to, is I know I joined Outreach in my current position at the beginning of the pandemic. And I know that healthcare services of any kind have been a real challenge during the pandemic. Accessing the healthcare that we need has been a real challenge. You compound that when you're a member of an LGBTQ plus community or any other marginalized, underserved community. So starting with you, Kathy, do you want to talk about the challenges you faced as a provider, and that maybe the panelists can talk about the challenges they may have faced? I know you're getting good health care from Dr. Oriel, but had Dr. Oriel not been available, how do you perceive that experience for you to be?
God,
You want to start?
So the pandemic has unfortunately increased what we call health disparities, meaning the overall wellness of a certain group based on, race, identity, orientation, whether English is the primary language. It's increase the gap basically between the haves and the have-nots. When it was a really hard decision with the pandemic, because I think, you know, it's so trite, but as physicians, we want to help people. And so I had this real ethical issue. I'd given up hospital privileges, and had to kind of figure out whether I was okay with that, because I had colleagues who were flying out to New York and doing a week at a time in the intensive care units, but ultimately decided at okay, Melissa Arndt, Nurse Melissa, boss lady, wisdom, is kind of like, you know, we can help more people by staying here and doing Zoom visits. And so that's what we did.
And the clinic is relatively new in its current form, correct?
Yes.
I mean, you became a nonprofit. Did you want to talk about that at all, about why you made that decision?
I resigned my position at the UW, decided to start a solo practice that was named with my last name in the basement of what used to be a Taco Bell. And as Dr. Shannon Reed said, 2 bitches in the basement of a Taco Bell. And I'm like, yes, Dr. Reed. That's exactly what's going on.
Wow.
But then there was flooding.
Oh, that's right. I
And
forgot
we
this
didn't-
part.
Oh.
Friends and family and patients just showed up, took out all the really cheap Costco furniture, put it in the dumpster, and the person who came to pick up the dumpster driving this huge truck happened to be this amazing trans woman who was also a patient. Bought new furniture, flooded again.
Wow.
Connections Counseling very kindly let us move into some adjacent office space, and the roof started leaking.
Wow.
And what happened is that Nurse Melissa and I, although we hadn't publicly said so or even really had an explicit conversation, we kind of knew it was done. It was like, okay, we tried this. I thought to myself, okay, I'm going to behave and go work for a big healthcare system. Maybe not super behaving, but at least so I can hold down a job. And a group of patients started crowdfunding for us.
Wow.
And they raised like 17 grand in less than 3 weeks. And I was really uncomfortable with that because as owner of Oriel Medicine, that money was actually, would have gone to me. So talked to some friends in a small town Madison and Shoals Nonprofit Law, shout out. It's like, well, yeah, you can do this nonprofit thing, and that's
great.
it really is. So it was the community talking, and now we've got this kind of sweet office, you know, connected to a coffee shop, that looks like an actual place that people deserve to get healthcare in.
That's great.
Yeah.
Thank you for sharing that history and that timeline. I know you weren't prepared to answer that question, but you gave me, you put me in charge, so I was curious. So
yeah.
I was curious about that evolution. And what I find interesting about that is that the end result of that is you're better able to serve a community that already supports you and that you support. So it's a win-win. I mean, you know, I just got goosebumps saying that, you know, because you can't say that about the kind of health care that we typically get, that it's a win-win. So I just want to say thank you for that difficult journey that brought you to this place where you are today.
Oh, and
Yeah.
we now have 4 people who work for Out Health. We've doubled, our employees. We're now calling ourselves a healthcare system.
Yeah. Yeah. All right. Well, that story might be a little difficult to follow up to, but I'd like to hear from each of the panelists a little bit about your journey. Whatever you're, comfortable sharing about how you found maybe Dr. Oriel, how that experience has been, and what you've benefited personally from being a patient of a healthcare system that has really been designed to support members of our LGBTQ plus community. So whoever wants to start, just kind of tell me a little bit more about your journey, whatever you're willing to share, because I understand that this is personal medical information and that I don't want you to share anything that you're not comfortable sharing in a public forum.
And I was thinking that the perspective as a parent of school-age kids is, I keep talking to people being like, I don't know how you do it. So Ryan, I was thinking that would be a helpful perspective. And then B, I know that I don't want to use the word caretaker, but you're also helping out your mom. So COVID just brings out concerns of, people who are smaller and people who are a little bit
Well,
older.
I'll just let it go that I met Kathy or Dr. or Kathy. 18 plus years ago. Not so good time in my life, but I met her through a wonderful lady who's in the community. I don't want to disclose any names because I don't think that I can do that.
Yep.
But introduced me and connect me with Kathy, and I wasn't on hormonal. I'm transgender, male to female. My pronouns are her, she, and hers, and my life changed dramatically. I mean, it's been on hormonal therapy. It's for the body, but I mean, a lot of that crap, that stuff in the head and that stuff just calmed down by being on the medication and stuff. And I'm so grateful for that. And I'm like, I'll take it the rest of my life if I have to. But that's when we met. But I'll go skip ahead to the pandemic part. And since you mentioned the caretaker for my mom, my mom actually, she wouldn't feel too good about this caretaker taking care of me. If you don't take care of me, I take care of you. She gets around better than me still. She's always dusting and cleaning and everything. But during the time of the pandemic, we had just moved back. I left Madison for about 6 years. Springfield, Illinois was a choice that I wanted to go. I wanted to go to Illinois because I was born there, but I know nothing about Illinois. Bad choice because I felt like I stepped in a time machine back, and they're so behind back in the 80s there. But I chose Springfield because I grew up in the capital. And I'm thinking, okay, I'll stay there, but I don't like it. So we came back. And during the time we came back was before the pandemic. You would hear it on the news and stuff, but then it hit. It was here, and at that time, when I came back, I got a job right away, and it was at the Dollar Tree, close by my house. And I was working there, plus me and my mom was sharing an apartment. She has recently moved out on her own apartment now.
I don't want to get in trouble with anybody's mom.
Working there during the beginning of the pandemic, I wasn't really more concerned about myself. I was concerned about me going out into the community, work, and coming back home, putting my mom at jeopardy as being a senior. And so I went through the whole thing about where they say, take your clothes off at the door and your shoes and stuff. And I do that, and I sanitize and everything. And I even social distance. And it would make my mom feel so bad. Like, you don't even sit out here and talk to me and stuff. And I'm like, in my mind, I'm like, well, Mom, I've been out in the public, and I'm trying to keep you safe and stuff by being in the room and stuff. But we got through it. I eventually ended up quitting working for Dollar Tree because it just began to be too ridiculous with the crowds coming in there and the kids and stuff when they let school out. It's like, I was like, they let school out for you to keep your kids at home, but it's like the toy section in the Dollar Tree became their playground. And so I quit. I just flat out quit. I'm like, my mom's health and my health is more important. And so we social distanced together at home. I came out the room more. We did more things together and everything. And I got this wonderful call later on from my now current job at Project Respect. One of the girls had took off for some medical issues, and just temporarily would you be willing to fill this spot? You know, most of the caseworkers are working from home, and you'll be in the office mostly by yourself. And I'm like, oh, perfect. Now I get to work again, you know. But then there was the commute back and forth to work by public transportation, which made it very scary then, because people were getting on the bus at the time before the mask mandate was really into effect without their mask and everything. And I'm like, I'm all shielded up and covered up, and I'm thinking about me going out there and coming back home to Mom and stuff. And so I had to get a car. That was the bottom line. I just had to get a car. Working in the office alone, my boss was there. Excuse me, I almost said my boss was there, and sometime, but I was mostly in the office by myself. My position couldn't work from home because I had to be there active to answer the phone for clients and stuff. And this job, what I took on there, and during the pandemic, just elevated, you know. I'm assistant case manager now. I'm a victim advocate. I'm like the mother hen of I do so much. We have a food pantry. I'm in charge of the food pantry. And I want my clients to come in and feel like they're going shopping, you know, in the grocery store. Most food pantries, they have you come in, oh, you can only get 2 of those, you can only get 1 of those and stuff. But I'm like, go in, get what you need, just think about others, and come on out. Now, the free clothing center, I wanted them to feel like they're stepping into a boutique. I wish I had pictures because it is so beautiful. It is set up like a little boutique. It's really cute and nice, and I love it and stuff.
So I'm hearing a theme already between Kathy's share and your share. And the theme that I'm hearing is how the community gives back to you, and then you give back to the community.
Oh, I love giving back to the community.
You know,
I love giving back to the community.
And, you know, I think that's something that is really important in our LGBTQ plus community and other marginalized communities, is that when we're given the opportunity to give back to the people who've helped us, we are generous, we're open-hearted, And it's so different than if you take a situation where somebody who needs services can't get services, and their self-esteem and their life just diminishes. So thank you for sharing your story. That's very empowering. And I'm glad you landed in a great place, and I'm glad you're not in Springfield, Illinois, 'cause we need you here. So Ryan, do you want to talk a little bit about your journey? And I'll let you determine what part of your story and what you want to share.
Yeah, that's a long story. I'll start out with when I met Kathy, which I was thinking in my head, 2006 maybe, 2007. She actually took care of me when she was part of UW. And then she left, she vanished. I was very sad. In fact, her former PA could tell you that I've only seen a PA since. True story, because I refused to connect with another doctor, because I just enjoyed how much time Kathy would spend with each individual patient, even if it meant I was late. I remember sometimes I was there after hours, but it didn't matter because she gives great attention. So anyway, that's how I first met her, and then she left, and I didn't really have contact with her in a medical sense because my insurance wasn't going to be accepted at her new place, but that's taken care of now. So that's my story of how I met her. In terms of the pandemic and how that kind of affected my family and I don't even know where to start. Is it fair to say COVID long hauler? Can we agree?
Yes.
Yeah, I've been given the blessing because I am one of the fortunate people that got COVID before we knew in this country what COVID was and what it could do to you. And I was really lucky to be hit with it so hard that it took away pretty much everything in my life, my job, my health, my sanity, my independence, everything. It was the most devastating illness, and still is, that I can think of. I'm still 2 years on dealing with ramifications, long-term medical ramifications from being ill. So fast forward to dealing with those ramifications for the last 2 years and losing a career that I loved, in part because of that. I got into a pretty dark place. And as I was starting to crawl out of that dark place, which took a good long time, I realized that I needed to be 100% authentic in my own life before I could be 100% healthy. And in that process, just very recently, October 9th, I came out to my wife as trans, which at 45 years old was kind of a surprise for her. Not so much a surprise for me, but felt good to get that weight lifted off my shoulders and to finally come out. And that is how Dr. Oriel and I got reunited, because I was still in a pretty dark place and knew that I needed to address this part of myself and get medical intervention to be my authentic self in order to continue my journey of getting healthy, and frankly to stay safe. So that is kind of how, in a roundabout way, the pandemic has affected me personally. On top of all that I just described, I do have 2 school-age children. I was a first responder. By happenstance, I got to be off of work for 2 years, so I was home to do the schooling part, but my wife treats patients, so she could not be home. And we talk all the time that we don't know how families with 2 working parents were able to survive without somebody quitting their job or losing their job, just because of how time intensive it was to care for your children and to become the school teacher and the lunch person and the gym teacher and trying to figure out math, and then trying to explain the pandemic to them in a way they could understand, keep them safe without freaking them out, and try to keep them entertained and healthy and mentally healthy when basically their world was the 4 walls of your home. So yeah, the pandemic was rough in a lot of ways on me and on my family, for sure.
It's interesting, as I'm listening to your stories, and as Kathy sort of introduced at the beginning, not only does Out Health and Dr. Oriel and her staff provide whole person health, but it's whole family health. I mean, we're talking about different generations of the same family getting the care that they need, maybe not in a direct way, but when that person who's at the center of that family is getting the help that they need, the whole family benefits. And on the contrary, when people from our marginalized community, however they define themselves, often don't get the care that they need. So one could suppose that that means that the whole family and that circle around that person suffers too. So I'm very moved by both your stories and how, yeah.
If I could add something.
Absolutely.
That the role of stigma
Mhm.
and shame in healthcare settings is just so big.
Mhm.
And you know, as I've said to more than one patient, well, you know, physicians are just insecure rule followers. Well, some are rule followers, but kind of people are insecure. So then there's this judgment about like an addict or I'm like, at what point this lovely woman that I cared for years was going in to get knee surgery, and the notes, this former cocaine addict. I'm like, this person hasn't used in 30 years. When do they no longer get to be a former cocaine addict? And similarly, like, at what point in medicine does the fact that you are assigned a gender at birth that is different than your identity, it's not relevant except for what surgeries you've had?
Yeah.
And I'm like, 55-year-old guy with crushing substernal chest pain. This is true. The note from the emergency room, this 55-year-old homosexual male, I'm like, crushing substernal chest pain.
Yes, we are not our diagnosis.
And these labels make people not want to interact with the healthcare system. And it's a privilege that we have this nonprofit so that I'm able to spend more than 10 minutes with patients. There's a lot of good physicians and providers out there that are just caught in systems that force them to not see people as their whole self.
Right.
Sorry.
Well,
Getting off my...
Thank you.
No.
Getting off my...
That's a good transition to a follow-up question that I'd like to ask everyone. We are not just LGBTQ plus people. There's an element of intersectionality in all of our lives. It could be our religious beliefs. It could be our working class or ethnic background. It could be our race. It could be many things that when we interact with a medical provider or interact with the larger community, just as Kathy mentioned, you know, we can be pigeonholed as one thing when we are in fact many things. We're not just a trans person. We're not just a white person or a black person or a person who is a Muslim or a person who is a Christian or a Jew or is working class or unemployed or homeless, and the list goes on. We are all of those things and maybe none of those things. We're human beings who require, you know, care. So if you...
Preach it.
Well, you know, I'm not here to preach.
Hey,
But
you just did.
So I'd like to hear your thoughts about that too. When you not only walk into Dr. Oriel's office, but when you walk in other places, whether it be your workplace, the grocery store, the car repair shop, how are you perceived and what challenges do you face?
I'm not trying to knock the healthcare system, but that was one of the most uncomfortable places. It's like I'd rather stay at home when I'm sick than have to go to the healthcare, to the doctors to be humiliated in the waiting room, number one place. When you come out there and you call a person's name, it's in the record, I prefer it to be called B. And the nurse comes out and she loudly your whole name, your birth name.
Yep.
And you're looking like me and if your name is Tom, Dick or Harry, excuse my French. And they call you and everyone in the waiting room looks at you like, well, I thought that was a Sally. And you get up like with your head down and stuff. And one of another thing that used to bug me is like the first question when you're sick with a common cold or anything, a stomachache or something, is when is the last time are you sexually active? And they what's the word I'm using? Where they put, if they hear gay, they think right away, sexually active, and we're like freaks, we just like to get it on somewhere, but it's so not true. It was so very uncomfortable. I mean, it's a different experience coming to being a part of outpatient at Out Health with Dr. Kathy Oriel. It was different when I'd see her when she was a part of UW. I'd experienced that experience during the waiting room, but once I meet with her and visit with her, it just all releases from me.
Thank you for sharing that. Ryan, do you have anything you'd like to share on that subject?
Goodness, I think my story, I'm still very young in my transition, and I'm luckily waiting to meet my first asshole. Can I say that?
Mm-hmm. You can.
Done. So I've been very lucky in terms of how many coming outs have I had? My second coming out process that I've been well received and kindly received by most, if not everybody, at least outwardly into my face. I think the experience that I dealt with in the last 2 years, just relating it back to the pandemic, was more because I had a PTSD diagnosis from my time as a first responder. I feel like that clouded every medical provider's interaction with me, kind of like you were talking about, the presumption that gay people are, promiscuous and having sex with everybody. I think they saw that diagnosis in my chart and trying to explain to them what was going on with all these COVID things, and it attacked damn near every system in my body. I think they just thought I was crazy and kind of sent me on my way, and were very dismissive of what I was trying to explain was my daily reality. So I don't think that I got the medical care that I needed when I needed it most because of that presumption. And so, relating it back to Out Health as well, just my last appointment, Kathy said, we're going to do a head to toe. I think I was there 3 hours because finally someone was willing to give me the time to listen to all the things. And she said, start at the beginning. I was like, really? 3 hours later, I was just leaving. So I think... dealing with a different kind of assumption in terms of identity as someone who had PTSD, and that you're just crazy, and writing people off that way was more my experience, at least.
And also, we've all got our crazy. It's just what flavor and whether you admit it.
Yep.
Right.
Couldn't agree more.
But it...
And I find that, I'm going to tell a little bit about my story, because I find that comment that you just made to be very true. I'm a recovering alcoholic for 35 years, and my medical records indicate that I'm in recovery. And they always ask me, do you drink? And I'm like, No, I stopped drinking 35 years ago. Do you smoke? No, I stopped smoking 34 years ago. All of that's in there. And I know that that's part of what they are supposed to do, is review your medical information. However, it's sort of like, how many times do I have to talk about what I used to be like, and as Kathy was talking about earlier. The other thing is, I recently, and I have to say this, I've been pretty lucky in getting the health care that I needed over the years. And part of that was I could afford insurance. I was employed. I was married for a while to a man who had good insurance, and then I was able to afford my own insurance through work. When I came out as a lesbian, you know, I had good doctors for the most part, but I noticed a change. There was a certain point, and that I found this to be an interesting observation, where the physical touch part of my examinations, when I came out to all my practitioners that I was a lesbian, some of the women, and it was a teaching hospital, so some of the students didn't want to give me a breast exam, didn't want to get, you know, were very, I could just tell that they didn't want to touch me. And I just filed that information away, and then sometimes would change the healthcare providers, because the theme of this panel is protecting our health. And one of the things that's impressed me about everybody on this panel is you've all advocated for your own health. And one of the ways you've advocated for your health is you've aligned yourself with a healthcare provider that treats you with the respect and the humanity that you deserve. So I just needed to put that out there, and many people don't have insurance. Many people don't have the ability to articulate what their need is, and so they're often at the mercy of the prejudices, the concerns, and that of the people that are supposed to be taking care of them.
This is going to be my mouse.
Okay.
So true.
Because when name, date of birth, sex active with men, women, both, neither. like that information. Thank you for laughing. That information is really important to take better care of the human, but kind of shouldn't be with anybody touching a screen and like clicking a box. Because really, you're not going to disclose what's important,
Right.
when there's hands on the mouse. So, and it's really difficult to know what to document.
Right.
Because what people would disclose to me, they think they're, again, especially when I was part of a larger system, like they're telling somebody that knows them and knows for years. I naively document it in the electronic health record, not knowing, and again, orthopedic surgeons are very good to have when you need one, but not knowing that the orthopedic surgeon who's just gonna like replace the knee now has all of that incredibly difficult, incredibly private information. So we know that communication between health records is important for patient safety in certain ways, but then it gets complicated about what you're documenting because now everybody can see it.
I'm going to share a quick story. I know I'm not a panelist, I'm a moderator, but this is really engaging me, and the comment that you made specifically to an orthopedic surgeon and osteoarthritis. I'm being treated for osteoarthritis, and when I started seeing my team, I had a whole team. I had a dietitian, a physical therapist, and I had a psychologist. And the psychologist was talking to me because of my reticence to do the exercises that I needed to do. I'm not a very physically active person. I've struggled with getting in a physical exercise program. So one of the things the psychologist asked me to do, and this speaks right to your point, is that I'd seen her twice, once in person and once virtually, and she said, what I'd like you to do now, because some issues came up about childhood trauma, and she says, I'd like you to do a trauma timeline, and I want you to kind of talk about all the things that happened in your childhood that you feel might be impacting you today and some of this resistance that you're feeling. Well, I'm the kind of person, because I'm in recovery, she wants an inventory of my life. I can do that. And I shared it all in great detail, and it was a wonderful exercise for me. But to the point that you're making, it is now part of my medical record. And she gave me a diagnosis based on that. And that diagnosis, when I read the MyChart notes, I'm like, holy shit, that's what her takeaway was?
Yeah.
So, I'm really kind of resonating with the stories you're all sharing and the information that you're sharing as a provider.
Excuse me for butting in.
No,
but
please.
That reminds me of a time when I got a hold of my medical records, and to list the things I found out, because I'm who I am, transgender. I have to have a identity issue. I had to be a whole bunch of things. It was like 17 lists of things, and it's like, and come to find out that, because you're transgender, you could get disability. Where's the disability? I could walk, talk, where's the disability in being transgender? I don't get that.
Right.
Yeah.
And the truth is, there are some people who need the help.
Yes,
But
I
you,
get it.
but I've only known you for a couple of hours, and you apparently are a person who can
The
really
wheels
take care of
are
yourself.
Coffee She may not make it back from this.
Yeah. So,
But it really hurt it, though,
Yeah.
to see all that stuff listed about you when you're this,
So, yeah, I would we're getting near the end of the time that we allotted for this discussion, but this is a good segue, I think, into the last thing I wanted to talk about, because this was really important to Kathy when we first started talking about this panel, was not only do we want to protect our health, we also want to protect the privacy of patients.
Yes.
And the privacy issues when we do get the treatment that we need. So as part of that whole person health, and as part of that protecting our health, would each one of you like to talk a little bit about protecting our privacy?
So the medical system historically has treated marginalized groups way worse. And I guess I would encourage everyone to be very careful about any information they give away. Especially during a time when people's autonomy regarding their own bodies, whether it's people with uteruses that need to make decisions about a pregnancy, whether it's people with a history of substance use, be suspicious of anyone who wants a lot of personal information, because historically we haven't always used that for good.
Yeah. Thank you for that reminder.
Yeah, I don't really know that I have a great way to address that question head on. I'm a relatively open book, maybe to a fault. My journey in coming out, my second coming out story, right? I should make a book out of that. I'm an open book. It's all out there because I just personally am that way, and I think that others can hopefully get some solace from that and follow behind if they need or want, and know they have an ally. So I guess I'm probably not the best person. I would say that I've had great success, I think, in the last 2 years in the various programs and providers that I have been able to be in touch with and to work with more extensively than just a one-off. I feel like I have been able to have frank conversations with them. I feel like they have been very respectful of information that's been shared, and that they've been, I think, dedicated to doing what's best to get me as healthy as they can, while still managing my private information and keeping private what should be private.
Great. Thank you, Ryan. Ms. B.
I agree with Ryan.
All right.
Yeah.
All right.
Yeah.
Well, go ahead, Kathy.
So I'm going to be out about this. I have a lot of concerns about people giving away genetic information, because there's so much we don't understand, and you're essentially consenting to someone else having information that may be related to you, that may not know they're related to you. And representation is really important, but it's a mixed bag, and I tend to be very trusting, but I get concerned about people giving away information that they're not quite sure where it's going.
Thank you.
But that's me.
So before the panelists say goodbye, I just want to thank each one of you for being as open and honest and shared, and that you were willing to share what you could, because the people who are going to be seeing this, just to let you know, Outreach will be putting it as a video. We found that when we've done the previous programs for the Road Forward as a webinar, not many people viewed it when it was live. Because they had conflicts, they couldn't log on at the time that the webinar was. So we posted the recording of the webinar, and we got over 2,000 hits. And those previous workshops, much like this panel, reached our LGBTQ plus community and was very informational and really helped people who were dealing with same issues. The previous workshops dealt with homelessness, food insecurity, underemployment, unemployment, substance abuse and use, alcohol, and mental health issues. And now we've talked about protecting our health, protecting our whole person health, protecting our whole family health, protecting our whole community health. And I'm just really impressed by the journeys that you've all taken, and that we've arrived at this place. And the one thing I just want to remind people is we've talked a lot about Out Health providing LGBTQ plus services, but Dr. Oriel and the Out Health Clinic also provides family health, also provides alcohol, substance use assistance for people who are trying to reduce the harm.
And we also care for straight people who
Exactly.
don't struggle with substances.
Exactly.
Come on, straights and allies, because by getting care with us, you're actually supporting the greater mission.
Yeah.
And
You need to hit on that greater mission. Do it. Go.
All right.
So you're welcome
you,
to.
you should say more about the greater mission. Like, how are they helping by showing up?
Oh.
Good question, Ryan.
Thanks.
Because honestly, if you're getting care and you have health care coverage, then that money allows us to give free care to
Right.
people who don't have coverage or also who have coverage but they're under 26 and they don't have a supportive parent. So even though technically they're insured, they can't
Right.
get the care they need, and that allows us to see folks.
You may be distributing this after the event, but if there's ways to donate after the event, I'm sure there will be ways to do that.
outhealth.org/donate.
I want to thank everyone. I want to let you know that if you would like a link to the video that you can have for yourself, and you can share it as you wish, we'll make sure that you get that. So I will follow up to get your contact information from Dr. Oriel if I have your permission to do that. And then the video, besides being in our outreach website, we will be sending it to our partners who have underwritten the program, which include MGE Foundation, which gratefully does a lot of work with our LGBTQ plus community. Dane County underwrites a lot of programs like Out Health. We're a nonprofit. And All of Us, Wisconsin Research Program, and the New Harvest Foundation. And the New Harvest Foundation specifically does grants for LGBTQ plus organizations. So I want to thank you all. You're welcome to sit at the table if you wish while I do the closing remarks, or if you'd like to leave, you can. I'm going to leave that up to you.
Thanks.
Thank you all. Thank you, everyone, for sticking with us to this lively discussion that we had about protecting our health. Now we're going to take a few minutes and we're going to view a video from one of the organizations which is sponsoring the Road Forward initiative. We're going to be viewing a video from All of Us Wisconsin Research Program, and let me tell you a little bit about that. The University of Wisconsin-Madison is a proud partner of the All of Us Research Program and is a member of All of Us Wisconsin Consortium. The consortium represents a large and diverse patient population covering the entire state of Wisconsin. All of Us is run by the National Institute of Health. UW-Madison is calling on volunteers like you and hopes you will help make history and change the future of health. The health data you share will be added to the All of Us Research Program database. Researchers can access this data to conduct studies. Watch this video for more information.
Meet Ray. Ray lives on a farm. He loves playing kickball with his grandkids, but lately he's gotten a little slower and been visiting the doctor a lot more often. This is Kim. Kim lives in the city. She loves to exercise, cook healthy meals, and can't remember the last time she called in sick. They're both people, but not all people are the same. And yet, when we visit the doctor, our treatments don't look that different. Why is that? Because we just don't have enough information to do it better, until now. Enter All of Us, the research program based on precision medicine. Precision medicine is a revolutionary new approach to treating and preventing disease that's personalized instead of one size fits all. By gathering health data from 1 million people like Ray and Kim and Trevor and Samir, our country's best researchers will be able to develop treatments that are as unique and complex as we are. With this new information, doctors will have a better understanding of disease so they can innovate the next great breakthroughs in medicine. Once enough people join, suddenly everything changes. Information becomes clear, patterns emerge, and simple data transforms into life-saving knowledge. This means that Ray and Kim's children and their children's children can live longer, healthier lives. By becoming one of the first 1 million people to volunteer, you can help reshape the entire future of healthcare for generations to come. If we can figure out how to fly, put a man on the moon, and connect the entire world, surely we should be able to improve the future of healthcare. Not just for Ray and Kim or even you, but for all of us. Sign up at joinallofus.org. The future of health begins with you.
Please check out these resources, and I want to thank you again, the organizations who supported the Road Forward initiative, including the program today, the New Harvest Foundation, All of Us UW Research Program, the MGE Foundation, and Dane County. Lastly, I want to thank our community members who are watching this video today, and we hope you found in today's discussion that it is both informative and informing. OutReach LGBT Community Center is in Madison, Wisconsin. Please visit our website, it's in the resource slide, and visit us in person. Our hours are Monday through Friday, 12 to 7. And when you visit our website, you'll learn more about the events coming up and the support and social groups that we sponsor. Thank you so much for being with us today. I'm Linda, and I'll see you soon. Bye.